has been a really big step for me moving from New Zealand to Australia, but I think there has been an even bigger one when I actually decided to move from Greece to New Zealand. So yes, I mean, it has been a big decision for me, but I wanted to bring like my special skills to Gold Coast. That's because, first of all, I love the place. I've been there quite a few times already. And, you know, me coming from Greece, it's a really nice opportunity to find a warm, sunny place by the sea, you know. But other than that, I would say that I am aware of the need for periodontal specialist skills in the Gold Coast area. So I'm really eager to start offering my services to the community and deal with challenging periodontal and implant cases. In my spare time in Gold Coast, I would definitely want to continue with my sports activities, mainly swimming. I really enjoy swimming, and also tennis. I like long walks by the beach, and of course, I'm eager to learn what else the area has to offer. A periodontist is a dental specialist that deals with diseases and conditions that affect the supporting structures of our teeth and dental implants. And also, we specialize as periodontists in placing dental implants. Now, diseases and conditions that affect teeth, you know, most commonly known as gum disease or gum diseases, are diseases that affect the gums in initial levels of disease severity, and then it can become more severe and affect the bone that supports the roots of our teeth, and that's a more severe form of gum disease that is called periodontitis. The initial form of gum disease that we treat is called gingivitis, and it's just more of a superficial inflammation of the gums without causing any severe destruction of the bone around the teeth. That's something that we basically do on a daily basis. Regarding dental implants, we specialize in placing dental implants, but we also are very good at dealing with the complications that come with that, because dental implants are a very prominent treatment approach nowadays. And, you know, we can have both mechanical and biologic complications with this. And we as periodontists, we deal mainly with the biologic complications of dental implants. Bacteria that we have in our mouth can travel through blood circulation and actually affect other systems in our bodies. And that's why we could have an infection that originated from our mouth in more distant areas in our bodies. Another major breakthrough with the association of periodontal diseases and systemic diseases was the link between diabetes and periodontal diseases. We have a lot of data now to support that patients with diabetes present with more severe forms of gum disease, and the response to periodontal treatment might not be as good as non-diabetic patients, especially for the ones that they don't have a good glycemic control, meaning that the blood sugar is not well regulated. And also, this is a two-way interaction. That means that patients that have a well-controlled blood sugar respond more favorably to our periodontal treatment. And also, by having treatment for periodontitis, these patients can regulate their blood sugar in an easier way. And of course, I think there are over 40 systemic diseases that have been linked to periodontitis, starting from cardiovascular diseases like coronary heart disease, stroke, etc., going to arthritis, Alzheimer's, for pregnant women, giving birth to low weight babies or preterm birth, and also several forms of cancer have been associated with periodontitis. And by association, I don't mean a causative relations. I mean that patients that do have periodontitis are at a higher risk of having one of these systemic diseases. So by not having periodontitis, in a way, you reduce the risk of having one of these severe systemic diseases. A periodontist can contribute to the long-term success of dental implants because we are actually a dental specialty that has been dealing with the two basic elements that are necessary in order to ensure the longevity of dental implants. One, bone, and two, gum. So as periodontists, we have really studied extensively both the biology and pathology of gum and bone. And so when we place our dental implants, we make sure that we take care of these two elements to the highest possible standards. That way, we can have a successfully placed implant, but an implant as well that can last and be, as we say in dentistry, in health, comfort, function, and also in an aesthetic way. Major issues that we have to deal nowadays around implants is the so-called perimplantitis. I would say that perimplantitis is the equivalent of periodontitis around teeth, meaning gum disease around teeth, but in this occasion around implants. So what happens is the gum around the implant gets inflamed, and that leads to bone loss around the implant as well. So this is the so-called perimplantitis, and it's a difficult condition because unfortunately the treatments for perimplantitis are not as predictable as the one for periodontitis, meaning around natural teeth. That's why prevention in this case is of paramount importance. And I'm saying that because there is a stage that precedes perimplantitis, and that's called peri-implant mucositis. Basically, that's like gingivitis, let's say, around implants. So when inflammation develops around the develops on the soft tissue around the implant, it's a good stage to deal with it before it goes into perimplantitis. At that point, the disease is reversible, which means we can get rid of the inflammation and prevent an implant from developing perimplantitis. So prevention is really of great importance in this case. Most of the aesthetic procedures that we do in periodontics fall under the category of periodontal plastic and reconstructive surgery. And of course, just to be a bit specific about that, there are several procedures that we can do in order to improve aesthetics for our patients. For example, patients that when they laugh, they present with the so-called gummy smile. That's one of the examples. That means that their teeth are shorter than the normal length, and they show too much gum tissue, let's say, when they smile. So in this case, we can employ specific surgical techniques to increase the length of their teeth and reduce the amount of the gingiva showing when they are smiling. And this is called, for example, crown lengthening. On the other hand, we have patients that present with long teeth. Why? Because the gums have receded and they have exposed root surface. In this case, we do the reverse procedure, which means we add gum on the root surface, the so-called gum grafting, again, in order to improve aesthetics. But it's not only for aesthetics that can help us with function, because the patients can clean better. The advancement of technology has, of course, has had an impact in dentistry as well. And today, we do employ several new techniques and technologies in order to have a more comfortable treatment for our patients, but also get more predictable and better outcomes with our treatment. Also, in terms of materials, we have many new materials, from bone grafting and growth factors to membranes, that can help us a lot achieve better results. And the techniques we use themselves as well are most of the time microsurgical techniques with specific microsurgical instruments. And don't forget digital dentistry. Of course, it's a major component of our daily practice. And we use that mainly for implant planning and guided implant surgeries. I always try to listen to the patient. That's my number one motto. I'm still trying to figure out, the nature of human mind and soul. But I find that by listening to the patients, you learn a lot about them, about yourself, and you can deal with their problems in a more effective way. So I always listen first, then I do, my examination. I take all the necessary data that I need, and in the end, I discuss with them about the diagnosis, the proposed treatment, the alternatives. And because, we've all been to the dentist or the doctor and have been anxious or nervous, I understand that this is a reality, and we've all been there, actually. So I always try to reassure my patients and take it slowly and one step at a time. It's always a collaboration between us and the patients. The dentists are the first port, if I may say so, of entry for our patients. So it is very important for any form of gum disease to be diagnosed at an early stage. I mean, we all know it's a cliche, but it's true that prevention is better than treatment. So whenever a dentist sees or recognizes some signs of gum disease, he or she should take care of that as soon as possible. Now, if there is more severe gum disease, meaning periodontitis, then it depends on the level of skill and confidence of the dentist, if they want to treat the patient or they would like to refer to a specialist. But I could in generally say that patients with moderate to severe periodontitis would possibly benefit from referral to a specialist periodontist. Also, young patients that present with severe gum disease would possibly benefit from a referral to the specialist, to a specialist periodontist. I'm really excited because I know our clinic has one main goal: to maintain really high standards in delivering dental care to its patients. And of course, with you all guys, being a wonderful team, I feel really privileged to be part of your team. I can say that I'll do my best, to offer my services in the local community the best possible way according to my knowledge, skill, and experience. And I'm looking forward to working with all the general dentists and other specialists in the area. And of course, I'm open to communication from the dentist, from our dental team, from our referring dentist. I think that's something that's possibly the most important thing, not only in our profession, but in life as well, communication. So I would really like to be open to communication. I would like patients, colleagues, co-workers, feel free to call me or contact me and discuss any matter that might arise. And again, thank you very much for having me.